Hi, welcome in. Can I get your first and last name, please? Okay. Okay, how do you spell your last name? Okay. And your birth date, please? Okay. Perfect. Okay. So, we have a appointment for you today. So you're just getting your yearly checkup. Okay, have you had any issues going on lately? Okay. All right. So everything's looking good. We can start off by getting your temperature. I'm just gonna put on my gloves. Just gonna make sure that you're not sick. You might not feel it, but you know, with spring coming in, all that, like everybody's been getting sick, so we just gotta double check your temperature. All right, so we got the gloves on, and I'm just going to take this thermometer and put it in both of your ears. Okay, let me just turn it on. Good. Okay, just gonna put it in your ear. Okay. Alright, just give it a second. It's gonna be. Okay, interesting. Now we're gonna do the same thing on this ear. Give it a second and then it'll beep. Okay. Good temperature, no issues there. Let me just write that down. Okay. So, I'm just gonna put this on. Okay, so I just want you to relax and just breathe normally, okay? Just breathe normally. Good. Just breathe normally. Good. Good. Very good. Okay, now I want you to take a deep breath, okay? Take a deep breath. Ready? Good. Good. Just keep taking deep breaths. Out through into your nose, out through your mouth. Yeah. Into your nose, out through your mouth. Very good. Good. You're doing great. I'm just hearing your heart and your lungs, trying to see if you're wheezing or anything. Okay, now I'm gonna get the back, okay? Same thing, I need you to really do those deep breaths again, all right? In through your nose, out with your mouth. Let's do 5 big ones, okay? Okay? 5 deep breaths, ready? 1, 2, 3. Good. That was the first one. Okay, let's do another one. 1, 2, 3. Very good. Let's do the other one. 1, 2, 3. Good. Again. 1, 2, 3. And last one. Ready? 1, 2, 3. Very good. Okay. I didn't see anything wrong here. Everything sounded very good. Let me just write that down. want you to just hold out your arm like this and lay it down. Just going to wrap this around it, okay? Perfect. All right, let me get this started here. All right, let's begin. So just keep your hands still. Just listen to your arm right now. Okay. Okay, we can set this off. 1 second. Just let it inflate. Good job there. Your blood pressure is looking good. Let me write that down. Okay. Fantastic. So now I'm going to get your height. So stand up for me and just stay still. It seems like you're the same height as last year. Can you follow my light for me? Good. Very good. Okay, look at my nose. Okay. Tell me what side you see the light. Okay. Look at my nose. What side do you see the light? Okay. Look at my nose. Okay. Good. Very good. Okay, I'm gonna look closer to your eyes. Not seeing any redness. Everything looks good. Try not to blink. I know I'm very close. Yeah. Everything is looking good. Just replacing the top of this, and I am going to use this to look inside your ears. Okay, so now it's an otoscope, so just same over here. Same thing. Yeah, inside your ear looks really good. Let me just replace the cap, okay? Now I need you to open your mouth wide, and I'm just gonna look inside your mouth. Good. Say ah for me. Very good. Okay, I'm not seeing any redness. I'm not seeing anything concerning. Yeah, everything's looking good. Okay, let me just write that. Have you been sick recently? Okay. I'm not seeing anything so far. I'm just going to get your head temperature now. Just double checking. Okay, stay still. Good. It's just going to take the temperature around your face. Okay. And temperature is about the same. It's always good to have a second opinion. So I'm just writing that down. I'm going to cover one eye. Can you see my hand here? Good. Can you tell me how many fingers I'm holding up? Good. And now? How about now? Now. Now. Good. And here? How many fingers? Good. Very, very good. Okay. Can you see the tip right here? Okay, I want you to just look at the tip, alright? Just keep looking at it. Don't move your head or anything, okay? Just keep looking at the tip. It's gonna get closer and closer. Good. Okay, same thing. Good. Same thing, just keep looking at the tip. Keep looking at the tip. Good. Very good. Good. I'm gonna blow some air in your eye. I just want to see how your eye reacts to the air, okay? Just keep your eyes open. Try to keep them open, okay? One moment. Okay, ready? Good. Very good. We're gonna do the same thing but with a different air pressure. Good. So I'm just going to be touching along your face. I'm going to be palpating, touching. Okay, let me know if you feel any pain at all, okay? Okay, I'm going to palpate now. Good. So I'm going to do kind of the same thing, but I'm going to use this little hammer that we used before. It's very light. It doesn't hurt at all, okay? So let's start. Good. Okay, very good. No pain, right? Great. Good, good, good. Okay. Now let's do the other side. Okay. Perfect. Did you feel any pain when I did any of that? Okay. So no pain. Okay. Thank you. Now we're going to move on with your ears. And I'm just going to do a quick hearing test for you. I have this tuning fork, and I want you to tell me if you can hear the sound, okay? All right. Can you hear that sound? Good. And do the other ear. Can you hear the sound? Good. Okay, now I want you to tell me when the sound stops. Very good. Very good. Okay, I'm going to be touching your ears. Tell me if you feel any pain. All right, can you hear this? This. Good. Okay, I'm gonna do like a beep test. You already got a little taste of that. I actually clicked the button, but yeah, it sounds like. So I want you to tell me when you hear the beep, okay? So for this one, you need to close your eyes. All right, you ready to begin? Okay. Mm-hmm. Okay, keep your eyes closed. This one's gonna be a little different. You're gonna try to, or you're gonna tell me how many of this sound you hear, okay? All right, let's begin. So how many times did you hear that? Good, that was 5 times. Try the other side. Good, very good. That was also 5 times. All right, I'm gonna put some, you can open your eyes now, by the way. I am just gonna write that down. Okay. I'm just going to blow some air in your ears like we just did with your eyes. We're just going to see if you feel any pain when we put some air pressure in your ears, okay? Okay. Just stay still. Okay, did that hurt at all? Okay, let's do the other side. Did that hurt at all? Very good, very good. Okay, so I have a little pick here, and I'm just going to touch inside your ear. Just let me know if you feel any pain. You shouldn't feel any pain. I'm just going to touch like the inner of your ear, but not too deep, okay? All right, so stay still. Was there any pain there? Okay. All right, any pain there? No pain? Okay, so no pain there. All right, so that is the end of our appointment today. So I'm not seeing anything concerning or anything wrong. You're not sick or anything. So everything has stayed the same from last year. I've seen no changes with your hearing, no changes with your eyes or your height. Same with the heartbeat, your blood pressure, everything is looking fantastic. Just writing some notes down. Doing this. Okay. But yeah, everything is looking perfect. No changes that you need to work on. You are fantastic. But yeah, thank you so much for booking this appointment with me, and I hope to see you again next year. All right, I'll see you around.